Hello everyone, this is MBBS Gallery. Today our topic is rhesus of pleura. Rhesus, which means a space. Pleura, this defines a lungs, a space between the lungs. Let's move to the topic. There are two rhesus of parietal pleura which act as reserved space for the lung to expand during deep inspirations. This is a reserved space for the lung to expand during deep inspirations. There are two spaces which are costo-mediastinal rhesus and another one is costo-diaphragmatic rhesus or costo-vertebral rhesus. From the name itself you come to know that the costo-mediastinal rhesus, which means the space present in the mediastinal region and this space is present in diaphragmatic region. This is the two spaces which is present in pleura. And costo, let us see about both of them. Before that, this is actually, I have said, this is the mediastinum as we know that, and this is the costo-diaphragmatic rhesus. In this mediastinum, we have a rhesus called costo-mediastinal rhesus, and this diaphragmatic region, we have a costo-diaphragmatic rhesus. So these are all the ones, and then we have to remember certain things here. This is right lung, this is left lung, and this is the mediastinal space, and there is a cardiac notch which is confined to left lung, and this has a significant note because this costo-medial rhesus as a space usually during breathing filled up by the anterior margins of both lungs. It won't be there during the normal breathings. Only the space is marked at the cardiac notch of the left lungs, so that it is most important. And here the costo-diaphragmatic rhesus, this is actually a space which fill upon during deep inspirations. As the lung expands during the deep inspiration, this space automatically gets filled by the left and the right lungs. So there is a procedure we are going to see in clinical significance. So during that procedure, this plays an important role. And let us see a little more detail about the rhesus. Costo-mediastinal rhesus. As I said, it lies anteriorly because as we know this mediastinum is present in anterior position, so it lies anteriorly behind the sternum and the costal cartilages between the costal and mediastinal pleura, particularly in relation to the cardiac notch of the left lungs. And this rhesus is filled up by the anterior margin of the lungs even during breathing. So it is only obvious in the region of cardiac notch of lungs. This is all about costo-mediastinal rhesus. Let us see about the costo-diaphragmatic rhesus. It lies inferiorly between the costal and diaphragmatic pleura, and then vertically, as I mentioned, it measures about 5 cm and extends from the 8th to 10th ribs along mid-axillary lines. Let us look at the book. This extends up about 5 cm from the 8th to 10th ribs along the mid-axillary line. So during inspiration, the lung expands into these rhesuses. So these rhesuses are obvious only in expiration and not in deep inspirations. Let us see about the clinical significance. Clinical significance here, pleural effusion. What is pleural effusion? Pleural effusion collects in the costo-diaphragmatic rhesus when in standing positions and presents on plain X-ray as blending of the costophrenic angle. This is the one. And a thoracocentesis, pleural tap, is often performed here while a patient is in full expiration because of less risk of puncturing the lung and thereby causing pneumothorax. Because during the full expirations, we can able to trace the costo-diaphragmatic rhesus. In inspiration, it gets occupied. That's the significance. So let us remember pleural effusion is the clinical significance. This is all about